Been doing beautiful since yesterday. Let's have a round of applause for ourselves, please. Nurse the nurse now, nurse yourself now. Thank you. So our next presenter is in person of Ajibola Olamide Ayomiposin.
Good afternoon, everyone. Good afternoon, everybody. So, standing on the already existing protocol, my topic is determinants of vaccine uptake among mothers of under 5 children in selected basic health centers. Introduction. Globally, the vaccination coverage rose from 86% in 2019 to 83% in 2020. 23 million children under 1 year do not receive basic vaccines, and which has been the highest number since 2009. In the year 2020, the total number of unvaccinated children rose by 3.4 million. High routine vaccination coverage prevents disease prevention. High routine vaccination coverage leads to disease prevention, outbreak control, and also improved child survival and development, preventing 4 million deaths annually. And then it has been a major issue to reach this high routine vaccination coverage, like in many developing countries like Africa. So for my statement of problem, a child was considered fully vaccinated if he or she had received the BCG vaccine, the DPT vaccine, and polio vaccine, measles vaccine, and yellow fever vaccine before their first birthdays. Despite being ranked second in terms of public health resources, such as health facilities and primary health care workers, the Southwest region had lower antigen coverage compared to regions in the country. So hence, this study sought to determine the vaccine uptake. Like among mothers of the under 5 children in selected basic health centers. Okay. This study assessed the following objectives. This study assessed the knowledge of mothers regarding vaccination of their under 5 children. This study also examined the attitude of mothers towards vaccination of their under 5 children. This study also assessed the level of vaccination uptake, and it also this study also identified the factors influencing vaccination uptake. Scope of study location. This study was carried out like in IAME and Morocco basic health centers, and the population was mothers of under 5 children, and the sample size was 130 mothers. The study employed a descriptive cross-sectional design to assess the determinants of vaccine uptake. Sample technique. I used a purposive sampling technique to get my selected primary health centers as my study setting, and for my sample size, a total enumeration technique was used to select 130 mothers who were going to the clinic for this period of study. For my instruments for data collection, I used a 5-sectioned questionnaire for this data collection, and each section was used to access their demographics, like their age, number of kids they have, whether they knew about vaccines, and also the questionnaire also was used to access knowledge, attitude, level of vaccine uptake, and then factors influencing vaccination uptake. Method of data collection. Participants were briefed on this study, and informed consent was obtained. Data was collected through 3 weeks by a 5-member team, and each questionnaire took 10 minutes to complete. The data was analyzed using SPSS version 23 with a chi-square. Chi-square was used for inferential statistics at p less than 0.05. Result presentation. So for my social demographic characteristics of respondents, you can see in the bar chart here that the questions, the ones down were the questions that were asked from the participants. So I asked each participant for the age of their child as at last birthday. 92.3% said their child was 1 to 24 months. 6.2% said that their child was 25 to 48 months. 1.5% said that their child was 49 to 72 months. And they were also asked for the gender of their children. 50% said they were male, 50% said they were female. And I also asked for their religion. 71.5% said they were Christians. And then also the participants were asked if all their children had received the right vaccination dosage, and then they were up to date. 96.2% said yes, that their kids have received all the vaccinations up to date, and 3.8% said no. Level of knowledge, 54.6%. Like we can see in this bar chart, there are 2 segments in the bar chart. We have 2 different color coded. So 54.6 said that they had good knowledge on vaccination, while 45.4% said they had bad knowledge on vaccination. Factors influencing vaccination uptake. So the factors down, each participant were asked to pick which particular factor they think would affect vaccination uptake. So 83.8% said it was where they lived. 37.7% said it was their finances. 92.3% said it was that 92.3% said that it also determined if a person attended the clinics during pregnancy. 95.4% said it also determined if a mother delivered in a health facility or with a TBA. 90.8% said that the times were not convenient for them. 65.4% were scared of the side effects on their babies. 86.9% said where they lived was far to the health facility. So I also wanted to test for the relationship between social demographic characteristics of the respondents and the level of vaccine uptake. So I also tested age, gender, religion, tribe, number of children, and also if all the children were all vaccinated. So it was just age and gender that showed a relationship with the level of vaccine uptake. This discussion of results. So despite good uptakes, delays and dropouts still occurred. Knowledge alone does not guarantee uptake. Implications of findings. From my findings, I found out that good information on the whole concept of vaccination will further foster acceptance of vaccine uptake at healthcare facilities. Conclusion. This study revealed that vaccine uptake among mothers in this selected basic health center was was high, which was 92.3%. Although some specific vaccines like pentavalent 3, OPV3, and measles showed reduced uptake. Recommendations. I am recommending that we should be able to give more health talks at the community and clinic levels to help correct misconceptions. I'm also recommending that we should improve clinic scheduling so that it can be convenient for the mothers that are coming to vaccinate their children. And also I am recommending to integrate a reminder systems, like sending them messages before the day of their vaccination schedule to help remind them. Then these were the selected references. Thank you very much.
Applause, please. So thank you, Ajibola, for that presentation. So mothers of under 5 are really going to the facility to uptake immunization. But somehow, some of the immunizations that are not single doses, you realize that they have dropouts. They often will take the first dose, and somehow along the line, they fail to take the rest of the doses. So our healthcare people in the clinics, you are doing well. But part of the factors we have observed is that there is a need to schedule vaccine clinics in a way that will be convenient for the mothers to come, so that they will be able to complete those vaccines that are more than single doses. Thank you for your presentation. The next presenter, before we go to the next presentation, please, a quick one, bring out your paper for lunch day 2. Your lunch ticket. The lunch is to be served. So don't forget, don't throw your paper away. So the next presenter, as we take our lunch, is the person of Akife Ololade Queen.
Good afternoon, everyone. I hope we're not sleeping. Okay, so standing on all existing protocols, my project topic is perceived effects of social media usage on academic performance of students in University of Medical Sciences, Ondo. So we all know what social media is, right? And we all have at least one social media that we are using. Okay, so social media includes applications like Instagram, Facebook, WhatsApp, LinkedIn, Twitter, and so on. So social media refers to platforms enabling interaction, content creation, and sharing, which have become vital communication skills. Social networking services, particularly via smartphones, have reshaped educational and professional activities, providing opportunities for networking, learning, and collaboration. An example is online classes. Now, we can have classes online through Zoom and Google Meet. So positive impacts include easier access to educational resources, collaborative learning, and enhanced networking opportunities. However, excessive use of social media can lead to distractions, time management issues, and lower academic performance. An example of distraction, I'm sure that there is someone somewhere that is scrolling on Instagram or watching TikTok videos as I am speaking. So, statement of problem. Excessive social media use among students distracts them from academic tasks. They even use in inappropriate settings. For example, using your phone in church, using your phone during classes, and even using your phone now. So students' attention is divided between social networking and studies, negatively impacting academic performance. The quality of education is declining as social media usage increases. Obviously, when you use social media a lot, let's say out of 24 hours, you spend over 5 hours using your phone, just scrolling, and then you still have to sleep and you have to study. The time spent on social media, just scrolling and not doing anything, can be spent on reading and other things. But when you don't do this, obviously there will be a decline in quality of education. So my study explores how social media affects academic performance for students at the University of Medical Sciences, Ondo. So the objectives of my study. The broad objective is to assess the perceived effects of the use of social media on academic performance of students in UNIMED Ondo, and also to assess social media usage among students, to assess the impact of social media on academic performance, to identify factors influencing social media usage among students, and also to determine the effects of usage period of social media on students and their academic performance. Okay. Please, are we all together? All right. So, study design. I adopted a cross-sectional descriptive research design. Then, for the sample size and sampling technique, multi-stage sampling method was used to select 155 participants from various departments in the university. Okay, so instruments of data collection. A self-designed and well-structured questionnaire was used for data collection. Then the method of data collection, informed consent was obtained from respondents before the questionnaires were administered. Please don't be distracted though. Okay, so ethical consideration. Ethical approval was obtained from the Health Research and Ethical Committee of the University of Medical Sciences. And statistical analysis. The data was analyzed using the SPSS version 23 and inferential statistics at p less than 0.05. So my results from the study. Socio-demographic characteristics. So majority of the respondents were female, aged 15 to 20 years. And social media usage. WhatsApp and Instagram were the most commonly used applications by these students. Impact on academic performance. Respondents noted that distractions, lack of interest in studying, and poor preparation for exams were major effects of social media on them. Do we agree with this? Do we agree? Okay, so factors influencing use. Social media is primarily used for communication and also entertainment. Usage period. Majority of the students said that they spent over 4 hours daily on social media. Social media usage. WhatsApp, Instagram, Twitter, and TikTok were commonly used during classes. And respondents acknowledged that it has a negative impact on their exam preparation. This is true, right? Okay, so no direct impact on academic performance. Despite high social media usage by students, there was no significant relationship. From my study, there was no significant relationship between social media use and students' academic performance. Influence of demographic variables. Age, department, and level of study were found to significantly affect social media usage and academic performance. So in conclusion, social media use does not directly impact academic performance, though it impacts study habits and preparations. My study shows that undergraduates spend over 4 hours daily on social media, which aids communication and learning. But this same social media also causes distractions and poor exam preparation. So parents should monitor usage, and teachers should also regulate it and also regulate it during classes to reduce negative impact on academic performance. An example is Dr. Adigun. Can you use your phone during Dr. Adigun's class? Exactly. So more teachers and lecturers should try to impact that type of style. Recommendations. So school counselors should educate students on the risks of negative social media use and promote educational platforms that support academic success. So it's not every time Instagram, TikTok, WhatsApp. We can also use other social media applications to learn. Teachers should regulate social media use in classrooms to minimize distractions. And then finally, regular seminars and talks on proper social media usage should be organized to enhance students' academic performance. These are my selected references. Thank you.
Thank you. Another round of applause, please. So from this study, even though other literatures have said that social media has impact on academic performance, but for this study in UNIMED, among those respondents, we observed that even though they were spending more than 4 hours on social media, it actually did not affect their academic performance. So there was a balance, and it is that balance we want you to maintain. But we also found out that they do Instagram during classes. So please don't do Instagram again during classes. So folks that we get, you will not receive them again. So thank you for your presentation. Next presenter. The next presenter is in person of Akinbode Oyin.
Good afternoon, everyone. Standing on existing protocols, my name is Akinbode Kosola Favor, and I'm here to talk about my research project. And the title is Determinants and Level of Vaccine Acceptance and Uptake Among Women of Childbearing Age in Selected Secondary Schools in Ondo State. It's not. Okay. So when I say childbearing age women, I'm talking about women within the age bracket of 15 to 49. And we have people of that age range in this setting that we have. So childbearing age women, they have certain vaccines that they are meant to collect. And these vaccines help to prevent maternal and neonatal morbidity and mortality. This study shows why women in Ondo Town are hesitant or unwilling to take vaccines, despite the fact that vaccines help to prevent maternal and neonatal diseases. Now, on to my statement of problem. In Nigeria, there's still low uptake of these vaccines, despite the fact that they said that there are maternal vaccines that help to prevent severe infections in mothers and children. These maternal deaths and neonatal deaths, they are preventable, and there are vaccines that can prevent them. But these diseases, they are still high. There's still high death rate of mothers and children. Scope of study. I performed this study using two selected secondary schools in Ondo Town, and they are All State Secondary School and ADME Demonstration Secondary School. Now, my study population, like I said, among childbearing age women, so I used their female teachers. And in total, for both secondary schools, I had a total enumeration of 71 female teachers. objective of my study. This study is to identify the determinant and level of vaccine acceptance and uptake among women of childbearing age. This objective was I did this research to assess the level of knowledge of vaccines, to assess their attitude towards these vaccines, to determine the level of acceptance and uptake of vaccines, and also to assess the factors that influence these vaccines. Then hypothesis. From my study, I took an hypothesis. I tested the relationship between the social demographic status and vaccine acceptance. That why do these women, why do they not use vaccines? Like, what is their reason? Why exactly do we not take vaccines? So there was no significant relationship between the social demographic status. Okay, methodology. I used a descriptive study for this research by using self-designed questionnaires to determine the level of vaccine acceptance and uptake among women of childbearing age. Like I said, 71 female teachers, and I had a reliability score of 0.7. And each of my questionnaire focused on my objectives, which were to assess knowledge, attitude, level of vaccine acceptance, and factors influencing uptake. Then, method of data collections. I used secondary school, like I said, with some of my friends that assisted me, and it took each of them 5 minutes to fill these questionnaires for me. Ethical approval. I took ethical approval from the university, from the Health Research and Ethical Committee of the university. Then for my data analysis, I used SPSS version 23, chi-square. Then my results presentation. Like I said, I used female teachers, and these female teachers, most of them were Christians. While the remaining 31% of them were Muslims. 50.7% of them were single, while the remaining of them were married. Then educational level, most of them went to tertiary. 50.7% of them studied up to tertiary institution, while the rest at secondary level. Number of pregnancies, as I've indicated there. Then my results presentation, the attitude towards vaccination. It was observed that majority of them have, like 40% of them have negative attitude towards vaccination. Why their knowledge? They had poor knowledge on these vaccines. If I should ask most of us here that, do you know the vaccines that are meant to take as women of childbearing age? Most of us don't know. Examples of these vaccines that are meant to take are hepatitis, HPV, tetanus, toxoid, yellow fever. But I'm sure that most of us here, we are actually not aware. So we have poor knowledge generally, though. Then factors influencing vaccine. When I carried out this research, I asked them of certain factors that hindered them from collecting these vaccines. And most of them said that their fear was fear of injection, nurses' behavior. I don't know, maybe as nurses, we turn them down, or our reaction towards these certain vaccines, maybe when they want to take the vaccines, it was negative towards them. Then most of them also said the distance to health facilities, maybe the TFAIR. Then some of them also said time wasting, that they felt like it was a waste of time, or the process of collecting the vaccine was long. Then most of them collected their first dose. Most of them took the first dose of these vaccines, and just a few of them were fully vaccinated. Then hypothesis testing. Then when I tested for the relationship between social demographics and the level of vaccine acceptance and uptake among women of childbearing age, I just realized that just age, marital status, and number of pregnancies were significant. Then in terms of cost, when I tested about the relationship between attitude and factors influencing acceptance, just cost was significant to the attitude and factors influencing vaccine acceptance. Then there was a significant relationship between the level of knowledge and level of acceptance of vaccine. Then discussion of results. Like I said, majority of them had poor knowledge. So majority, and this is not just in Ondo Town, it's something that has reflected in other studies, even in other places. For example, like Ebonyi, Lebanon, and Ghana. So it was also shown there that there is also poor knowledge on these vaccines. Then attitude. Like I said, there was poor attitude from my results. But despite the fact that they had poor knowledge, they had good attitude. They were willing to take these vaccines, provided that they were aware of the importance of the vaccine and they were well educated on these vaccines. Then acceptance and uptake. The uptake was low because majority of them were not even aware of these vaccines, that these vaccines existed. So the uptake was low due to certain barriers like fear of injections, distance, nurses' behavior, cost. Then influencing factors. Most of the factors that influenced their acceptance were accessibility. It was distance, it was quite far from where they were. Then affordability, they said it was quite expensive. Misconceptions, like maybe they felt like it was quite harmful to them. Then health providers' attitude, like I said, nurses' behavior. Then summary of results, this is just like a graphical representation of the results. Then now, implication of findings from this research that I carried out. Here are a few suggestions that I have to help vaccine acceptance and uptake among childbearing age women, even within us here at the university level. Public health, like I said, there was poor knowledge. So we should try to there should be public health education on these vaccines, that these vaccines do exist. And they should also build vaccine trust, because some of them were scared of the myths that maybe it could harm them, harm their children. Some of them were not aware of the benefit that these vaccines had to offer. Then healthcare practice. Nurses and midwives, they should be clear and empathic when they are giving maternal vaccines. For example, if you want to talk to them about hepatitis B vaccine, why they should use hepatitis B vaccine. When you are trying to explain it, you use terms that they can understand. Most of them, they were just like, what is hepatitis, what is tetanus toxoid, what is HPV? They were not aware. It's just the big names that we know among ourselves. So we should break it down to them. If you are saying that hepatitis, you can explain to them that it's something that prevents liver breakdown, that is related to the liver, like Jedo, that is injection for Jedo to stop injections, to stop the infections. Then policy, the government bodies should enforce policies that will make women to take these vaccines. Maybe, for example, they should make a law that if you are in the university level and if you're of a certain age and you've not collected this vaccine, maybe it will hinder maybe reduce your salary, punishment, admission. It should just be enforced, even as university students at the university level. Then in conclusion, this study concluded that childbearing age women have poor knowledge on maternal vaccination, and they have high willingness to take these vaccines, but however, there is poor uptake of vaccination. So therefore, there is the need to increase public enlightenment on maternal vaccination. Then recommendations. I recommend that there should be health education on this vaccine, their benefits, their safety, even to us at this university level. It's very important, because I'm very sure that most of us here, we've not taken certain vaccines as women. How many people have taken their tetanus vaccines here? Hepatitis vaccine, HPV. Thank you. So there should still be more awareness, because some people still don't even know about this. Then there should be healthcare workers training, patient communication. Like I said, some of them said that their fear was nurses' behavior, our attitude among midwives. So there should be a training that will train healthcare workers on how to not be judgmental, how not to be judgmental on these vaccines when it comes up. Then accessibility, we should bring it closer to them. Like some of them said, distance. If they should, for example, they should carry it to marketplaces, outreaches, take it to communities, take it to them, because most people will not go to the hospitals. They have major issues, so they should bring it closer to them. Any contacts that they have, they should bring these vaccines closer to them. University outreach, they should bring it close to university environment. Then policies. The government, like I said, the government should enforce mandatory preconception and maternal policies. Then media campaigns, use of social media, radio, television to combat myths and vaccine trust. So they should talk more about this, about vaccination on radio, television, and social media. Then here are my selected references. Thank you.
Thank you for that presentation. Another round of applause, please. So as women, we should take vaccination. You take TT, 5 doses, HPV, 3 doses. How many of us has taken yellow fever here? When did you take yellow fever? Mélòó? Ìgbà tá ti jẹ́ baby tán ti fún wa mọ́. Láti gba yellow fever if you are going to be sincere. Àfẹ́ni tó bá tún fẹ́ travel out. And this you should do every 10 years. Yellow fever every 10 years. Your HPV 3 doses. Your TT 5 doses. Ó rẹ́rìn toró mọ̀ pé òun ò tí gbà. So you realize that we people really don't have information about these things. And when they do, it will reduce maternal mortality. You know, a woman that is yet to be married, she's single and has already taken TT complete. You should know that the ones she wants to take in pregnancy are just booster doses. She's already secured. So thank you, audience, for listening. Last presentation is done. Ẹ̀bẹ̀ 10 minutes ni kò wọlé ní kò ní UMI.